Hey guys, welcome to the Toad Dogs podcast. I'm Dr. Ingky.
I'm Dr. Ali here.
I almost screwed up the initial part.
I love it when you do introduction.
Yeah, man.
I'm always looking forward to screw up a little bit,
Yeah,
but
let's
it's
screw
fine.
up every
It's all part
time.
of fun.
Yeah,
So anyway,
exactly.
two doctors here, and we usually talk about non-medical. Once in a while we do talk. However, the last October and November we're on a roll. So October we were talking a lot about
I also forgot already.
mental health.
Mental health, yes. We spoke on mental health, right?
A bit slow already.
Yeah, a bit slow already. So the mental
November.
health is not so good already.
Yeah. November, however, we've been
this is more
talking about
interesting.
sexual health.
Yeah, this is
Sexual
more
health
interesting.
awareness. So
Yeah.
I think it's something that people don't talk enough.
Yes, that is right.
And true to our nature, we like to talk about stuff that people don't want to talk about.
Yes, that is true. We want to address topics that you don't want to talk about, right? So we address it on your behalf.
Right. Then you can go and Google search more, and then when we bring in guests, right, you can actually go and ask them a lot more questions, So last week we were with Dr. Anaand. This week we're still going to be with him, because apparently we record 2 in the same week, and we don't want to let him go because
Yes, exactly.
the topics were so good.
Topics were good. There's a lot of things out there.
So many things that we learned, even as doctors, we were still learning.
Yes,
it was
correct.
like re-education all over again. Anyway, for those who missed out last week we were talking about
STIs,
sexually
STDs,
transmitted infection, the difference between that and disease.
Yeah, the prevention, what kind of testing that you should do.
That you should do. And this week we're going to be talking about living with HIV. What you should be doing. So without further ado, we're going to reintroduce Dr. Anaand back in again. He's going to give a brief run through, and then we're going to go jump straight into the deep end. Hi, Dr. Anaand.
Hello. Hey guys, thanks for having me again. I'm Dr. Anaand and I run a sexual health and infectious disease clinic in Bangsa. So yes, I'm back here again for the second week.
All right, so let's talk about HIV, right? All right. So what does HIV stand for?
HIV stands for...
Wait.
What's that?
Hair is vanishing.
Hair is vanishing. Oh yeah, hair is vanishing. See Dr. Ali. It's okay.
Sorry, I had to do that. Okay, sorry. Coming back to you. So,
Right, okay. Well, if hair is vanishing, then that's what we have for you, Dr.
yeah,
exactly.
This week we got 2 HIV experts.
One up, one down.
Well, actual definition is human immunodeficiency virus. So that's how we identify HIV.
Okay.
Right. Now I need to throw a quick question. How do you differentiate HIV and AIDS?
One is symptomatic, one is asymptomatic.
No.
Okay, so HIV is the presence of the virus in your body.
Acquired
Right.
immunodeficiency
Yes.
syndrome.
Syndrome,
So
correct.
There's a
Yes.
syndrome.
There's a
There's
syndrome,
many things that
there's
you need to cover
manifestation
in.
of
Absolutely
different
correct.
symptoms.
Yeah.
Thank God. Okay, still answer. All right, come. Actually, I was about to throw that question at him. Then he go and throw it at us first. Next time, don't put off things that you can do immediately.
exactly.
Don't wait,
There you go.
Right. So never mind. So for those of our listeners, right, who are not sure what's the difference between HIV and AIDS. So Dr. Anaand, what is the core difference between HIV and AIDS?
HIV is actually the initiation part. When you get infected, the virus is just got transmitted to you, And that's when we run the testing, we see the antibodies positive. Then we run the PCR test, HIV PCR. We get the viral load. It shows, okay, you have this many copies. And along that side, we also need to identify the CD4 counts, which is apart from your T cells. It's broken down into CD4, CD8, CD8 plus and all that. So CD4 plays a crucial role here. So that identifies as your immunity level, how high, how low it is. Usually when on baseline, your viral load is high, your CD4 will be contrary to that, will be low. So we have a benchmark. If your CD4 is below 200, that automatically puts you in a situation that this is not HIV initial stage anymore. This is how we categorize as AIDS.
Oh.
Immediately.
Okay. So it doesn't matter when was your first test, as long as your CD4 count is below 200, your immunity level is low,
It's considered AIDS.
you have
Considered
AIDS.
state. Yes, of course. And then
Regardless of any manifestation. Or generally they will
Regardless.
start to have symptoms by then.
Of course,
Usually-
by
usually
that
by then you
time,
would have
you can. But the moment you look at the patient, this has been ongoing for quite some time already. Because it's very subjective. Some people will be completely asymptomatic for years and years and years. And suddenly, for the 10th year, they start losing weight drastically, 30, 40 kilos, losing hair. All these things tend to happen. No appetite, becoming very lethargic. Those are the common symptoms actually. And then okay, this thing has been ongoing for a couple of years now, maybe.
Okay.
So when the moment the results comes back, it's less than 200. Sometimes it's less than 50 even. So that shows that how bad your immunity has crashed throughout the year. Slowly, but eventually it happens. So, and then your viral load is sometimes sky high. It can be in millions sometimes. So then we know, okay, for sure, this person has been in this situation right now. We need to speed things up and initiate treatment plan right away for this patient, actually.
Okay. All right. Give us some demography. Roughly, if there's any such details, how common is HIV infection in Malaysia?
I would say it's actually, back in the day, I think I would say, let's say in the scope of 5 years' time, it has been, that time it was very common. So within these 5 years, there's no drastic drop or drastic increment in the numbers statistically. It's been plateauing all the while, actually.
Okay.
But still, the cases are there.
Is that because of
Lack of testing?
lack of testing?
Lack of testing,
Or just people are generally more sexually aware?
I would say lack of testing.
Lack of testing.
Yes, especially in certain states that, can I mention what state it's in?
Yeah, sure thing.
Especially coming from states like Kelantan and Terengganu, they report the highest number of cases every single year.
But that's because they test.
Those are the one that is tested, but what about those who are untested? Goes without being recorded, know.
Right.
So even that, the numbers are really, really high, to be honest.
Okay.
So yeah, I would say that is the case actually.
Very interesting. All right. Last week we were talking about when someone gets exposed, they should get themselves tested as soon as possible. And if you are unsure, 3 to 5 days after your exposure, get yourself tested for HIV with the PCR method.
Yeah.
Any other methods that has come into light, or any new progress over the years?
For now, what the quickest way that we can actually check for HIV post-exposure is within 8 to 12 days, where we proceed immediately to check for HIV PCR, which is the viral load testing. So that is highly sensitive in that short period of time, 8 to 12 days, that's it. So if you miss that window period, you have to actually wait till the end of the month and then get your antibody testing done. Yes.
Oh, interesting. So means that if you want to get yourself tested, the earliest is within 8 to 12 days.
Yes.
Most accurate.
Most accurate. But however, once you've missed the window, you need to wait until end of the month, after 30 days.
Yep.
So there is actually a pretty big gap there, actually.
Big gap. So in other words, to simplify things, it's like saying if you got yourself infected and let's say this number of virus that's in your body, so the first 8 to 12 days is when it's the highest. After 12 days, your body starts to attack it a little bit.
Yeah.
So
there's always a spike, then we can know, okay, it's actually picking up. This is an acute phase. And subsequently, it will start plateauing. The numbers won't increase anymore.
Okay.
But
then your body has already started to have antibodies.
Yes.
Okay. Wow.
So that's like in a month time. That's when your antibody results comes back positive. Initially, antibody is not going to show anything, right? It's way too soon, actually.
Okay.
Yeah.
Okay. All right. But let's say if someone gets HIV and their loads are mediocre, but their CD4 counts are great.
Yes.
Would they manifest any kind of symptoms? Any early symptoms?
No.
Or none?
When the CD4 is holding up in, let's say, 500 to 600 counts on baseline, that shows that the immunity is actually pretty good. It's holding up strong. So we don't need to do further testings or like prophylactic measures and things like that just because the viral load is high. No, we just start them on antiretrovirals. That's enough for now. And then monitor them on a monthly basis first for the first month, subsequently 3 months after that to see how it's actually corresponding. Okay. If in a different case where the CD4 is also crashing, we need to do a lot of prophylactic measures. We need to do a chest X-ray to rule out opportunistic infections like PCP that causes pneumonia.
Yes.
And then we need to check whether this person has cryptococcus or not. Any fungal infection in the throat, we need to do an oral swab. So a lot of things has to be done actually to rule out other possible opportunistic infections. So this is when somebody's CD4 is less than 200.
Then they already qualify as having AIDS.
Yes. And then we need to put them on strong antibiotics like Bactrim. Bactrim is known to cause a lot of hypersensitivity issues in a lot of people. So they need to take Bactrim until the CD4 count has shot more than 200.
Okay.
It can be 6 months. It can be even a year sometimes. It depends how well the body is responding.
Okay. Now, assuming somebody is relatively asymptomatic.
Yep.
What are the kind of any change in the lifestyle that they must do apart from the testing?
Yeah.
Always, because CD4 doesn't respond to medication, right? It doesn't respond to the antiretroviral drugs, of course. So you need to, if the patient is smoking, stop smoking, slowly reduce, alcoholism, whatever. If you're taking any other drugs and whatnot, you have to stop all those things. Everything plays a role here. Change your dietary habit. Lifestyle modification is very, very important. Eat healthy, exercise, plenty of hydration. By just doing that, within 3 months, you can see a drastic improvement. If you stop all of these things, smoking alone, if you stop, you can see so much of improvement, just like that. Your CD4 counts will start picking up by itself. You don't need anything else.
All right. Can someone who is HIV positive, but without AIDS, of course, HIV positive, live until old age? Right, because there was an old stigma whereby once you get HIV, you get AIDS, you die within a couple of years. Yeah, but now it's possible to live until a really, really old age.
Yes, absolutely. And the stigma was also saying back in the day that the moment you touch somebody, you can also get HIV. It's not like that anymore these days. The moment you start your medication as soon as possible, once your viral load hits less than 20 copies by Malaysian standards, you're undetectable. Undetectable means untransmissible. So you can actually live a long, healthy life.
And you can be married. You can have kids.
Absolutely, you can get married. You can have kids. You can have grandkids. No problem whatsoever.
So you're saying it's okay to have non-condom sexual contact
with your partner. We call this serodiscordant couple. So one is positive, one is negative, plus and minus. So usually what we say, the person who's positive has to be on retroviral drugs. So the person who's negative, let's say the wife, and she wants to conceive, so she needs to be on PrEP.
We're gonna come to that in a while. We're gonna come to that in a while. So this is where it gets interesting.
Yeah.
Which to summarize the question, can a HIV person have normal sexual contact or bear children without the need of using condoms or going to IVF?
So basically, as long as the viral load count is really
low, your CD4 counts are high. So your immunity is high, your viral load is low. How you optimize yourself for
your health,
preferably a monogamous relationship. Preferably. You can't stop people, right?
Exactly. So basically, it's you no longer need to fear. You can live a long and healthy life.
Because the stigma with HIV, and up to even for myself, I would say recent up to the last 6 months, is that if you are HIV, you are pretty much done for.
It's like that sentence lah.
You condom yourself for the rest of your life. So no kids for you. No other form of sexual enjoyment, and it's just
regular testing,
and condom, and that's it.
Medication. So you were speaking on PrEP, all right? And I read that something called PEP as well. So could you tell us the difference between PrEP and PEP, and what does it stand for, and what are the major differences?
PrEP is pre-exposure prophylaxis, PrEP, right?
Pre-exposure. So before
being exposed to the virus.
Before you being exposed, you take this magic pill.
So it means you are HIV negative.
Yes, you have to be HIV negative. That is the most important thing here, actually. If you're positive, this thing is not going to work for you. Okay? Because so PrEP is actually, when you give a medication to somebody who's HIV positive, it needs 3 drug combination. So PrEP is one pill that contains 2 part of that combination of the drug. So which is not enough for somebody who's positive, right? They need 3 combination. But it's enough for somebody who's negative. Because it's a prophylactic measure.
So it's like a shield.
It's like a shield, of course. So once you start taking this pill, it will form a shield within the first 7 days itself. It's very quick acting, very fast. Protective efficacy level is up to 98%.
Oh, this is really high.
Yes. So once you take it, you treat it.
Condom was 95% last week.
So that is a misconception, and that is not a license to not use a condom.
There you go. I have to ask this question for you guys out there who's been asking it by yourself.
A lot of people think the same thing. I'm on PrEP. Why should I use condom? Yes, PrEP protects you against HIV. It's not a magic pill to protect against anything other STIs. So you got to use both technically if you want to have complete protection, of course.
So how long should someone take PrEP for?
It's very subjective. It's individual decision, actually. It depends on how long they want to take. Some people take up to 10 years. Some people take up to like 1 or 2 years, and then they decide to stop.
But you take it every day?
The best way to achieve optimum efficacy is to take it every single day.
Every single day.
Yeah.
So it's a supplement.
You should just treat it as a supplement. There is a different way of taking PrEP, of course, but from our point of view, we don't really encourage doing so unless you have an existing condition. For example, kidney derangement, liver derangement, because the drug is being broken down there. So if you have a condition before even initiating PrEP, then you can't be taking it every single day. It can cause toxicity, nephrotoxicity and all that. So we suggest you take on demand, or suggest to take TTSS, meaning Tuesday, Thursday, Saturday, Sunday. So you take
Tuesday,
4 pills.
Thursday, Sunday.
Saturday, Sunday.
Okay, 4 pills.
4 pills a week. Instead of 7 pills, it becomes 4. But you should remember that if you take 4, the efficacy also reduces. It drops up to 95%, which is also equivalent to just using a condom.
Okay, I understood. Both. All right. So that's PrEP.
Yeah.
All right. How about PEP?
PEP is post-exposure prophylaxis. So PEP is actually an actual HIV drug with 3 drug combo altogether. So 3 components is all that. So these PEP has to be given within 72 hours post-exposure. If the person encounters an exposure, let's say in the club, somebody spiked the drink and they got drugged, they got taken advantage of, whatever happened, this person has no memory or whatsoever. So within the 72 hours of period of time, they need to start taking this medication immediately. So the whole idea of taking it also forms a shield against if there's any HIV transmission is bound to happen within that period of time. So that was not going to happen.
Okay. So it's a morning after for.
It's like a plan B.
It's a plan B.
Yes, of course.
Yep.
So
morning after.
Yeah. So before.
So that's
Before you before you go out for fun, you take PrEP. If you forgot about what happened, take PrEP.
Yeah. But for PrEP to work, you need to take it
7 days.
7 days before.
7 days before.
7 days for guys.
7 days for guys.
For ladies?
For ladies?
21 days.
Oh my
21,
God!
so it's
Why the
longer.
discrimination?
Because for the drug to penetrate into the mucosal layer of the vagina mucosa, it takes about 21 days.
Oh, it takes longer.
Wow.
Yes.
Wow. And does PrEP work fast for them too, or how it works?
Yeah.
For the ladies.
For ladies.
For
ladies,
PEP,
yeah.
yes.
Yeah,
PEP is the same because that one is a different story altogether. So they need to take right away, within 72 hours, whether male or female, they need to start taking immediately. And they need to stay away from any kind of sexual activities for that entire month because they got to take for 1 whole month. The regime is such.
Okay.
And that's it. 1 month and that's it. Not like PrEP where you have the option to take as long as you want. You know,
Stop
PrEP
whenever you
is 1 month and that's it. You stop.
PEP is 1 month.
PrEP
Yes.
is 1 month. PrEP is as long as you
As
want.
long as you want.
As long as you like.
Okay.
And then we need to, before they put you on PEP, you need to get yourself tested first, like a baseline testing.
Yes.
Preliminary round of testings, we call
Right,
it.
your baseline,
Subsequently,
your
after
levels
completion,
after that.
after completion, we need to repeat comprehensive screening with all the swabs and whatnot, whatever we discuss.
Okay.
Yep,
Anal swab, vaginal swab, anal swab.
all the
other
swabs.
All right. So because you see a lot of I would say HIV positive patients and as well as probably couples living with HIV.
Yep.
You know. So what are the general stigmas that they face on a regular basis?
Starts from the medical side itself, from initial stage where they were diagnosed, they don't know where to go, they just end up in random usual clinics, regular clinics where they're shunned away because the doctors are not comfortable dealing with HIV cases, although they're completely healthy, they have no idea they had HIV, just suddenly, incidentally found diagnosis, right? So that starts from there. That subsequently goes to the family, or they need to break the news to the family. Then they get shunned away. Some are even disowned by the family because of the status itself, And then it goes on to the workplace after that. And the moment the workplace got to know that they tested positive, they just want to get rid of them. And some of them, the expats, they're on the risk of being deported actually. So it's actually pretty bad. And we are in 2022. So it's not moving forward. Stigma is still around. It's just in a camouflaging here and there. People don't really realize.
So Dr. Anaand, you're saying that some employers, if they found out you have HIV, they would terminate your contract.
Yes, it has happened to some of my patients where they were either they contact me asking for like a supporting letter to explain like what is the status. That's fine still, at least they understand the status. They know that he's not in a risk of anything, so it can still work. But some, they just completely decide to just get rid of him right away and send him back to his country of origin immediately.
Okay, just for general knowledge, is there any industry specific areas whereby this, let's say F&B or certain kind of industry whereby they would terminate you quicker, or it's across the board?
I think it's across the board. Some are even from the corporate side actually. Well established corporate. I don't want to names,
Alright,
but
it's fine, it's
really big companies who are actually all over the world.
So they just don't want you to be there.
Yeah,
Is that wrong?
It's actually wrong. That is violation, basically, human rights. Why are you discriminating him just because of the status? He can work. He's doing his job. He's well educated, well qualified. He's been doing his job all this while, perfectly fine. Just because you got to know his status now, what is the difference here? And
I think that's quite discriminatory,
Yep,
because the same person or someone else could have had, let's say, hepatitis.
Yes.
And nobody cares.
Yeah.
It will come out in your blood report and nobody cares.
Yeah, of course.
Hepatitis B,
Yeah.
hepatitis C, no one's going to give... they won't bat an eye. They won't feel sorry for that infection. They won't terminate you.
Yeah.
But HIV, they do.
Exactly. Well, even if it's hepatitis, they equally needs to be treated. Equally needs viral load needs to be done. It is a viral disease, B or C, of course. Yes, it's treatable. Yes, it's curable at some point. C is curable. But still, you need to be, it is an infectious disease, They need to treat that exactly how they treat HIV. You see? So that is just not happening here.
Okay. Our podcast is also broadcasted in Docuity. And so there will be doctors who will be listening.
Yes.
I like the point just now that you mentioned one of the initial contact of discrimination
is by the doctors
themselves.
Yep.
How should a doctor handle themselves when they find out, or let's say you're running a GP, your patient comes in, did a test, HIV came back positive. How should a doctor handle? What would you advise?
We were all taught how to break the bad news. It's actually an art that you need to master. You need to tell the patient, yes, the status is such, and also try not to discriminate them or throw stigma at their face. As it is, they are depressed in a way because they can go into depression right away. What if the patient got HIV in an occupational hazard, not through a sexual hazard? There's always a possibility, right? Needle prick injury and all this thing. What if the patient is a professional? What are you going to do? So you really need to be in the patient's shoes to understand how would I handle the situation if something like this happened to me. That's how I deal with the cases actually. So you need to sit down and talk to them like how you talk to somebody who really means a lot to you. Tell them that there is help. We can move on from here and you'll be completely fine. You will live a long healthy life as long as you start your medications right away, and we will do this together. That's how you need to deal with this situation. Not like, oh, you know what, you can have HIV, this is it, this is the end of the road for you, that's it, done. That's not the way. But that is how some cases were handled by some medical professionals in some clinics. They were just referred right away. I don't do all of these things. Go to whichever clinic you want to go. You want to go to Klinik Kesihatan or hospital, it's up to you. No proper referral was even given. So that's how the standard is sometimes. It's very difficult to say.
I like the point that you picked on, whereby you mentioned it doesn't always have to be sexual contact. It doesn't have to be a lifestyle. It wasn't because of a lifestyle that you could have contracted HIV. Right. So for doctors out there, when you're listening in, don't prejudge.
Yes.
Could have been work hazard. Could have been accidental exposure. Could have been someone trying to help someone who had an accident.
It has happened.
I mean, if someone crashes and then you want to help him in an emergency,
you're
not going to ask him, are you HIV positive?
Absolutely,
You are there helping, and it happened, you had some open wound and you got exposed. You could have gotten infected for no good reason. It just happened. So I think put discrimination aside, treat them well. They've already had enough bad news. What they don't need is judging eyes.
Absolutely,
are there any HIV support groups in Malaysia?
Yes, of course. There is one in Sentul itself called CLASS, where they handle individual support or in a group support as well, depending what the patient is looking for. It's absolutely free. They're really helpful. I've referred plenty of patients there as well. And if the patient comes from in a financial situation they can afford to pay, that's Mind Faculty. In Monkera, there's a huge facility. There's clinical psychologists, psychiatrists, everyone is there. So if you want to have an individual time by yourself, you don't mind paying money, so that is the place to go. Really nice. I've sent patients there as well. Very good feedback from the patients itself. They feel really good talking to somebody. So those are the two places I usually refer the patient to, either CLASS or Mind Faculty.
Right. Any other tips that you'd like to give someone who is living with HIV or newly diagnosed with HIV? What they should do and how should they go about?
Newly diagnosed cases, I would say go to a proper place where you are welcomed, with an open arm. Leave your worries outside the door and believe that there's help. It's not a death sentence. There's so many thousands of people out there who are living happily, so you can be one of them as well. Always think like that. Yes, it's a diagnosis. End of the day, it's just a diagnosis. It doesn't define you. You are who you are. So just put the worries aside and there's help. So they need to implement that in themselves. People living with HIV, if they need any other help, like mentally and all these things, there is help out there. They should understand that, it's not go into depression and feel like, this is because there are patients who are like, you know what, I've been shunned away. This is the end of the road. I'm going to kill myself. And there are suicidal attempts. So they need to slowly, because if they can't tell that to themselves, how are we going to help them in a way? If they don't help themselves. So it's in a 50-50 situation that they need to take the first step forward in order for us to help them along the way.
And for general population, or let's say family, when how should they approach, or what should they do? I mean, obviously they should be giving love and support.
Yeah.
But sometimes it's easier said than done.
Yeah.
How would they want to handle, let's say, suddenly a family member has HIV, in terms of the dining, eating, living? Are there any major adjustments must they do, or how should they go about living together with someone who's having HIV?
There's no adjustment whatsoever need to be done. They should live life as how they were living, how they were actually sharing things, how they're actually eating on a dining table, completely as how it used to be. There's no need to segregate and, oh, this is your plate, this is your cup, this is your utensils. There's no need to do so. It's not contagious in that sense. They need to understand the disease. This is why it's important. Like somebody from a family member has contracted HIV, the family should understand what is HIV, how does it transmit, how is the route of transmission, what is the route of transmission, in what ways that we can actually help. They need to do some digging a little bit. So this have to be a little bit more proactive, I would say. A family should be there for this person, not just shun him away, So it's very important. So there's no need to be segregating him, put him in a different room, changing your blankets and pillows and things like that. It's not going to transmit in that way, actually. So they need to understand that.
Yeah, because I feel even like public health does not educate enough.
Yeah.
I think the last time I've seen one of these HIV posters was still the same. You can hold hands, you can kiss, but ask you to use different utensils.
Yeah, that is a malinformation actually. They shouldn't be telling that you should. What is the evidence behind saying that you should use different utensils? Why? What are you trying to indicate here? There's no information whatsoever. Why? And public health shouldn't be saying things like this. So actually, there's absolutely no indication there, unless in a situation, for example, he is actually in an AIDS situation where there's like ulcers all over and all the herpes outbreak and whatnot, then it's indicated to not share things. Or he's having shingles on the back. So then okay, I got to change my sheets and all these things. Then we know. If it's completely healthy, medicated, well under control, viral load is completely suppressed, absolutely no indication to do things like this. Why? So they need to understand.
In a way, I think COVID helped educate a lot regarding viral load. Don't you think?
True.
In a way. COVID taught a lot of people what viral load is all about.
Yeah.
And if you could relate that to HIV, is that if your viral loads are low with COVID, you're technically not infectious. So you don't need to do all that crazy sub-quarantine kind of thing.
Yeah.
But if the viral load is high, then yes, then there'll be some segregation. So perhaps that will be something similar.
Yeah.
If their viral loads are high, CD4 counts are low, and then he's having a lot of infection, then there are some adjustments that need to be done.
Of course, yes. It depends.
Okay. Any parting advice left that you want to give to the community, to our viewers, before we end the session, which is, really mind-blowing?
I just want to say that, I just want to bring it up again, saying that always get tested, regardless. If you know yourself, if you're sexually active, you have more the reason to get yourself tested. Anything under the sky, you might just carry anything under the sky, to be honest. You might be carrying it for months and years, you never really know. Always know your status. Always communicate with your partner is also key, regardless of whatever it is. If the partner is not willing to communicate, maybe it's not the one for you. So all these things you got to bear in mind. We are in 2022 right now, so put stigma aside, no judgment whatsoever. We all want to move forward from here. So I would just want to say something. I just want to say that, actually.
All right. So guys, girls, ladies, gentlemen, get yourself tested.
Yeah.
Unsure? Test.
Yeah, unsure test yourself regularly.
Yeah, test yourself regularly. There's no harm. And in fact, I think if you found out, it's not something to be depressed about.
Yeah,
but there's treatment options.
Yes, there's treatment options.
It's no longer a death sentence.
Yes.
The earlier you get yourself tested, the earlier you find something,
the earlier you
can get treated, and
the
you
better
lead
your prognosis.
Pretty much normal life.
Normal life.
I mean, if we can understand this with cancer,
Yeah.
The earlier you get tested, the less severe the stage is, and your treatment works well.
Yeah.
It's the same with sexual health.
Yep.
Test, treat as normal as possible.
Yeah, and you can live normal life.
With that, we'd like to thank Dr. Anaand for running with us 2 weeks in a row on sexual health awareness. We have covered some really heavy topics. Drop us a line, ask him any questions that you want. You can also visit him. You're based in Bangsa, right? And you can drop him a line, and he can even communicate with you directly and guide you if you have personal questions or if you would like to visit him to get yourself tested.
Correct.
All right, with that, we're going to close up this week on The Two Docs. I'm Dr. Ellie here.
And I'm Dr. Ingky, and
See you next week.
Dr. Anaand.
Dr. Anaand here. Thanks for watching, guys.